Well, I have the honor of welcoming you this afternoon. So on behalf of the City of Sanford and the City Council, please extend our most sincere welcome. Packed house. It's really incredible to see all the interest around this important topic. So leading up to this meeting, I wanted to educate myself a little bit. I wanted to get a better understanding of what the problem is and what the scope of the issue is right here in Sanford and in southern Maine. So I reached out to some folks in the front lines, and I do want to thank those people. Cheryl Kamari's in the room, Nicole Ivey from Strategies, Chief Connolly. I read his really incredible piece. It's a 15, 20-pager on the basics of the heroin epidemic and the opiate issues. And most recently, I spent a good part of the day with Sheriff King, Roux County Sheriff King, and toured the jail and met with inmates that were in the jail for a variety of reasons, but primarily for something relating to heroin. And from my perspective, this one made me lose a little bit of sleep. So it put some faces to a large-scale problem. And, some of the common themes I took away from that was, a desperation for services, a desire for change. I heard consistently that if I just move out of this city into this other city, my life would be a lot better. And I just thought, it can't be that simple. And just a general feeling of despair and lives in chaos. And these are folks that have been there for one reason or another, but generally all wanting help and wondering where to get that exactly. So the problem I sort of wrestle with is it's a difficult challenge. I'm not sure it has a right or a wrong answer, but it's going to take a community to fix that problem for sure. So we're looking at exploring today a really complex issue that affects us all one way or another, whether you're in the school department, whether you're a mom, dad, you have a relative, you know somebody, you're a taxpayer. I guarantee you there's tax dollars that are directly related to the heroin epidemic here in Sanford and throughout the state. So as we look forward, I'm proud to say that I'm one of 8 mayors in the state of Maine that are part of a mayor coalition that all agree that we need to take a common approach. We need to advocate and seek support at the state level for a variety of different avenues. Again, a complex problem is going to have a complex and multi-phased approach. Specifically, we're advocating for more education and prevention, enforcement for those folks that really need or deserve to be behind bars, and most importantly, treatment alternatives. Simply incarcerating addicts, from my perspective, isn't the answer. We need to provide alternatives. We need to find redirection to services for a lot of these folks. So lead program is law enforcement assisted diversion. So again, it's redirecting these folks to a support structure that may or may not exist today. So we need to really explore those options, and I hope that we can come to some understanding of A, what the problem is, and B, what are the potential solutions to those problems. So again, the community appreciates the work being done today. We appreciate the panel member. It's a strong group. It's a full packed house, so we appreciate that. And it really is an issue that we'll work collectively on, and we're looking forward to some solutions. So again, thank you, and we welcome you to Sanford. Appreciate it.
Thank you, Mayor Cote. It is my honor and privilege to introduce this panel. This is a very experienced panel. You will not see a group like this together often because their time is very valuable and they're out there working on these problems 24/7. So this is a great opportunity to learn about this. And later we'll have a chance for questions and answers and comments. So if you think about something during the event, please hold on to it because you will have their knowledge at your fingertips at the end. So I'm pleased to introduce from the Federal Drug Enforcement Administration, Mike Wardrop. He's the resident agent in charge of the state of Maine. Our very own police chief of Sanford, Thomas Connolly. Raphaelle Silver from the Attorney General's office. Dr. Andy Powell from Southern Maine Healthcare. Kate Meredith from Maine Behavioral Healthcare. Dr. Meredith Norris, who is connected to many organizations. We'll just pick one. She's the medical director of Grace Street Services. Connie Roux from Partners for Healthier Communities, which is the local Healthy Maine partnership here in Sanford. And then Miranda Gilman, who is coming forward to share her personal story about her road to recovery. So again, thank you for coming, and we'll turn it over to Mike.
My name is Mike Wardrop. I'm the resident agent in charge of U.S. Drug Enforcement Administration here in Maine. Based in Portland, I have an office in Bangor. First off, I'd like to thank the mayor for his kind remarks. You truly have some great law enforcement professionals in your backyard. Chief Connolly, strong advocate, breadth of experience, will hit these challenges head on, as will Sheriff King. They have great resources available to them. They work in partnerships with us. I happen to be the program manager over the statewide drug take-back program. These guys knocked it out of the park. But it was only successful because all of you came out and participated. And that's what we're going to do. We're going to take these challenges head on as we're here today. So what I'm going to talk about is from 30,000 feet in the air. What is DEA seeing in New England as it relates to the heroin trends, heroin in New England, fentanyl, which is really the biggest challenge that we're seeing right now, and then the overdoses to a lesser degree. Fentanyl is here. Doesn't matter how it's got here. We have an idea how it's gotten here, but we need to develop solutions as we move forward. This is no different than suddenly there's bath salts on ground zero in Bangor. What do? How did it get here? Doesn't matter. It's here. Now we need to have viable solutions to move forward and push forward, and that's what we're doing. So again, a visual of, opiates, the opium being grown. Heroin is really stacked up, and specifically in Mexico, and you'll see that a little bit more. Most the opiate sources, when it comes to heroin, Mexico, Afghanistan, Pakistan, Burma, Laos, and Colombia. Most people think of the Southeast Asian heroin that's coming to the United States. There's a very, very small percentage of heroin from that region of the world that actually comes here. Most of the heroin that we see is produced in Colombia. It's coming through transit zones, Mexicans primarily, and then through the transit zones here into the United States. Mexico, however, has ramped up heroin production. They've ramped up heroin growing, opiates, the poppy plant, 50%. So a lot of the heroin that we're seeing now is actually coming from Mexico in the eastern United States. National trends is both a mix of intravenous and non-IV users, whether they're snorting the product. Many different purity levels, but the biggest damning purity level and the challenge that we have is heroin that's being laced with fentanyl. Or in fact, a user thinks that they're injecting heroin. In fact, they're injecting straight fentanyl. And what you'll see is very, very damaging. Black tar heroin is predominantly found in the West Coast. Black tar heroin on the West Coast, and that's predominantly what Mexico was developing, growing, producing, transporting, selling here in the United States. It was a Colombian heroin. Colombia changed their methodology. When they were producing mass ton amounts of cocaine, and they were trying to basically control everything, controlling the factory on the ground in Colombia, controlling the transport into the United States, and the selling. And because of a lot of hard work by law enforcement and all the community partners, state, local, federal, they're just crushing those cartels, crushing the organizations. So what they did is they changed their methodology. They are now just a producer, and they would hand it off, the transportation aspects of it, to the Mexican cartels, which then basically was a handoff from Colombia, Venezuela, into Central America, and the Mexicans would handle the whole transport into the U.S. And that's what we're seeing now. So Colombians have really changed what they do, and the Mexicans have learned that by controlling the trade, controlling all the aspects of cocaine transport, redistribution, wholesale distribution, they can do the same with heroin. And that's why they've ramped up that aspect, because they have the environment to grow mass amounts of poppies. And again, it's a cultural challenge down in Mexico in what they're doing. Heroin availability. There's just a lot of heroin right now. And why is that? There's a lot of different pieces of the puzzle why. But if you go back 3, 4, 5 years, opiate pills, and they continue to be the challenge, but there were a lot of opiate pills. There was a lot of pill seekers leaving here, going to the pain clinics, pain centers down in Florida, trading in their license, getting a Florida license, and then going through a pain center where they walk through the door, they paid a $200 fee, and then they see a physician or a physician's assistant, get a script and walk down the hall a little bit more, go through the next door, like you're going through this building here, and go to the pharmacy and get their script, and then go fill it, and then they would get on a plane and fly back or drive back or take a bus back to Maine, and then they would sell it, use a little bit, sell it, which would then just populate that many more opiate users. Well, what's happened is law enforcement has crippled those organizations, crippled those centers where they could get all these pills, but the addiction is still there. Something has to fuel that addiction. People will do whatever they can to fill that addiction. And what's the easiest, cheapest alternative? heroin. And the Mexicans knew that, and the Mexicans have stepped it up. And again, a lot of great policing, a lot of great education as it related to the pills, the Valiums, the oxycodones, the OxyContin. But now you have the heroin on our back step, and that's what's ramped it up. And as a result, the seizures have gone up. Where we saw less than a kilo in large seizures, now it's a kilo and a half of heroin when we're doing large seizures. And that's, again, that's a 50% increase in a matter of years on a large scale. So heroin in New England Field Division. This is an imprint of our offices for DEA, federal DEA, here around the New England. Again, I have an office in Portland and an office in Bangor. But again, it's force in numbers. We work with Sanford PD. We work with the 8 offices of Maine Drug Enforcement. It's force in numbers. We work with Lewiston PD. We work with Portland PD. Anything to share the information, share the intelligence, target the traffickers. We don't care about those that are addicted. They're not on our radar. They're on our radar because we want to learn from them, because we want to learn where they're getting it from, so we can move up the chain and reach down to Lawrence, Lowell, Massachusetts, and find a Dominican organization and attack them and prosecute them. And we're very successful at working together and doing that. For DEA, our number one priority is heroin, without a doubt. That is our priority. We will work on the other organizations that are distributing crack cocaine, because a lot of those organizations in Maine, unfortunately, are gangs that are coming up from Massachusetts, coming up from New York City, which bring violence, propensity for violence, trading firearms. So again, they're on our radar. But heroin is our number one goal, is our number one priority here in the United States, or here in Maine, and again, across the United States. The biggest trend, and I'll jump right to the bottom to save a little bit of time, is the emergence of heroin and fentanyl. In its purest form, is very, very damaging, but in a setting in a hospital, it's very effective. It's a very effective painkiller. But it's being mixed, and it's in those that are on the street that are selling it, the distributors. They don't know that it's fentanyl versus heroin. They just know it's a really good opiate. And the substance abuser knows that, hey, that's a great high. That's a good stuff. I want to get that brand name, or I want, that packaging. It's important to me. But you can see that the cost, any of us, we don't have $45 or $120 to buy a gram. And that person might be addicted. They may need 5 grams a day. So where's that money going to come? Well, they're breaking into their parents' car. They're breaking in, taking GPSs, going to the pawn shop, stealing from their friends, stealing from their parents. Breaking into a house, taking pills, selling pills so they get the cheaper version of heroin. The cycle just keeps going and going and going. So again, the fueling of the cost. And who wins? The cartels. The Mexican cartels are making millions of dollars working off of us. Fentanyl, again, it's packaged just like heroin. This could be the packaging of any heroin, but it's fentanyl. A lot of the fentanyl that we're seeing is mixed with dipyrone, which is a painkiller commonly found in Mexico. It's the cutting agent, or a cutting agent, that it's mixed. Fentanyl is 80 to 100 times the potency of morphine, 15 to 20 times as potent as heroin. So if you have heroin at 90% strength, and now you're mixing it with fentanyl, you're just cranking the potency up where you're going to have overdose deaths. You're going to have instant overdoses. And that's what happened, we believe, a year ago when the Mexicans started pushing the fentanyl. They didn't know how to break it down. They basically have they have a brick of heroin worth $150,000, a 2-pound brick. And they put 5%, they made of 75% of a cutting agent and 25% fentanyl. But that's pharmacy-grade fentanyl that's being produced in a lab setting down in Mexico, in the mountains of Sinaloa. But again, 25% is so potent that it's going to kill you instantly. So they push that out here not knowing it. Who are they killing? They're killing their customer. Unfortunately, that customer is our community. It's our parents, our neighbor, it's our son, it's our daughter. They're killing us. So what have they done? They've changed the mixture and stretched it. So it's a smaller amount where it's maybe only 5% because it's just so dang potent. But again, in a hospital setting, very effective. It's a very effective painkiller. But again, they're preying on this. Extremely powerful doses are measured in micrograms. And you'll see a picture shortly. What's challenging for law enforcement is when we come into contact, we don't know whether it's heroin or we don't know if it's fentanyl. If you think of a grain of salt. You spill a little bit of salt in your counter, that one little grain. If that's pharmacy-grade fentanyl and you put it on your finger, it'll kill you. It'll be absorbed. It's that strong, it'll kill you. So that's for law enforcement. Or somebody, a substance abuser, or somebody just randomly comes into contact. That's scary stuff. So that's why we're using masks. We're wearing gloves. We're making sure it's not windy outside if we're doing a law enforcement field test. It's important on how we handle these things. Again, milligrams versus micrograms. That's a quarter, just a speck, and that'll kill you. A little thing. So just give you a visual of what could actually, what it can do to you. Buffalo, New York, and again, it's just gotten larger seizures as time progresses. And this was one of the first larger seizures, 8 kilograms of fentanyl in Buffalo, New York. DEA working with Buffalo PD, working on a tip, these 8 kilos. That is a lot of fentanyl because now it can be broken up in expanding the profit margin. Historically, if you were to go back 10 years ago, there were some fentanyl labs, and at the time there was a spike in overdose-related incidents, whether it be deaths or just overdoses. And those were labs that were identified in both Mexico and then other parts of the United States. And once they were identified, dismantled, the overdose deaths came right down. The overdoses came right down as it related to fentanyl. But again, now we're cyclical. Now we're 10 years later, and now we're seeing the same thing that happened 10 years ago. And we need to learn from that and moving it forward. Fentanyl encountered here in Maine. This goes back to February of 2014. In this instance, this was up in Caribou, northern Maine, where what they thought was oxycodone tablets being seized. Maine Warrant Service gave it to MDA. They sent it to the state tox lab. The little pill had the right imprint. It was fentanyl. That's scary. Where now you're thinking, the abuser, they're preying on that pill, but it's just another opiate. So again, this pokes around. This was New Hampshire earlier this year, the exact same thing. They're using fentanyl, they're tableting it, have a tableting machine. They're marketing it as oxycodone. It's being sold at $80 a milligram, $1 a milligram, or $30 a milligram. And they're overdosing because it's fentanyl. And this is ground zero. I think back to what we saw up in Bangor, what Bangor PD and the citizens of Bangor saw in 2011 going into 2012, and it was upside down. It was a crisis. This was, to me, it's like the largest ground zero for Maine as it relates to fentanyl. It was a year ago next week that the first largest seizure of fentanyl occurred by the hard work of the Sanford PD, hitting the ground.
Developing the probable cause, working with the district attorney's office in seizing a large amount of what they thought was heroin. But it wasn't testing right. So they surrendered it to us, we sent it to our lab, requested an expedite, and it was fentanyl. And it was also around the same time where there was a bunch of heroin overdoses in lower York County, in the Berwicks in that area. And we were developing other information related to the Dominican organization that was the backbone of this seizure. And working with our partners, working with MDEA, we identified that the Dominican organization down there and ultimately developed the evidence, indicted them, and arrested them, and they're being prosecuted in the District of Maine. So again, working collaboratively with all our partners, we developed the intelligence to move forward to identify the organization. Because just arresting a street dealer in the corner isn't going to help the situation, because they're going to backfill it. You need to move up and cut the head off the snake. You need to find the trafficking organization that's behind the crisis that's occurring here in Maine, and working together. So again, working forward, we're going to continue to focus on heroin and fentanyl traffickers. It's what we do. We're good at it. We have the tools, we have the resources, and we work together. And we put all of us in one sandbox. It doesn't matter whose badge you have. If we're in the sandbox, we have one common goal: get the bad guy, and that's what we're going to do. The collaboration, prosecution of drug traffickers. Judge Delahanty at the U.S. Attorney's Office is fully committed. If somebody that's selling fentanyl or heroin is brought into his office for prosecution, damn no, his assistants they're gonna clobber him, and they're gonna go before the judiciary. And for the first person that has been distributing fentanyl that's related to overdose deaths comes before one of the judges, I wouldn't want to be them, because the same thing's gonna happen to them what that Judge Woodcock did in Bangor. He's gonna hand down some pretty tough sentences. And then truly the most important component is on the bottom. It's education and treatment. The enforcement part is important, but I equate it to you have all these pill abusers, all these substance abusers from opiate, that it wasn't just somebody, the branding. It's not just this person in the back alleyway that's been addicted. It could be a police officer, it could be a physician, it could be an attorney, it could be a pro athlete. You have this huge pool of a legitimate use of that opiate for some type of remedy. But we've created this huge pool now of substance abusers. If you were to eliminate all the pills right now, What are we going to do if, that 10,000, that grouping of 10,000 people? We need to do something, and that's where education and treatment truly come into play. We need to get them back on the train. They're on the sideline. We need to get them back on the train so they can drive forward and be part of their families, and the broken families build it back together and be a responsible, providing member of the community. And that's where that component comes forward, and it's truly, truly an outstanding component. And something that we just did internally with DEA, and again, this is really with our law enforcement partners, police, EMS, and fires. Again, we're trying to learn. So we've developed this card. It's a go-to card for those responders to learn from the scenes of. It's intelligence driven. We're trying to identify, who's the dealer that just sold heroin to that person in Arundel that just died last night. We want that, we want that number, we want that information, because we want to start working up the chain and figure out who's that person, who's the next person, and identify the trafficking organization and bring it before the judge. That's our ultimate goal, and it's also a guide for first responders that aren't used to having heroin deaths. A lot of times somebody dies, the parents are hiding the needles, everybody's hiding everything. It's a crime scene. Somebody just died. And we need to come together. It happened, but we need to learn from it. We need to get that evidence so that we can identify, who's a responsible person or organization or trafficking group out of Boston. We need to learn from that, and that's why we're using this card to get it out there. Right now, there's 40 police departments that have requested them, and we're just going to keep marketing this and branding this because there's things, innovative things that we can do, and it's something as simple as a card. But just going down that back, it's important information, and we can learn from it. So that's, I'll take any questions afterwards. I know we're kind of shy on time, and we'll move things forward. But again, I appreciate everybody coming here. This is truly important. This is a great showing from your community. And you have a depth of experience here in the room. So definitely, if you have a question, ask it. No question is a bad question. Thank you.
Chief Connolly, the floor is yours.
Well, I did not do a PowerPoint presentation, unlike Mike's fine presentation that he did. My name is Tom Connolly. I'm the Chief of Police. I've been here, fortunately, for 8 years. Hope to stay another few, if they'll keep me. Can everybody hear me out there?
We just killed the mic.
Oh, good. Okay. I'm sorry, who? They killed the mic. Oh, they killed the mic for me. Oh, okay. All right. Well, usually no one has any trouble hearing what I have to say anyway. So I'm going to take the easy road here and just say that everything Mike said was right on from the law enforcement perspective. Sanford, like any other larger city in Maine, being a service center, has a lot of people living here who live here because we have services available. We have hospitals, we have access to social services. So we have a lot of people living here in the lower socioeconomic groups. And we have a lot of people living here who are substance abusers. They abuse marijuana, alcohol, methamphetamine, cocaine, but especially now the issue of opiate abuse has taken the forefront because of the number of deaths related to it. So I, as a police official, understand that we have to attack this as a law enforcement issue to a point. I would again defer to Mike and the DEA because, in my opinion, probably the most effective strategy is to figure out somehow, some way to interdict this stuff at the borders before it comes in here. I mean, we know most of it is being made in Colombia or Venezuela. We know that it's being shipped to Mexico and it's coming into our country across the border. How do we stop it? Now, anybody who watches National Geographic Channel, last night they had a great piece on about the cocaine wars in Miami in the 1970s and 80s. And if you have a chance to watch something like that, you get an idea of what it's like to try to be a law enforcement official that's trying to interdict a drug that everybody wants. And right now, everybody wants heroin. And why do they want heroin? Mike brought the point up. It used to be opiate addiction. It was a lot better when you could buy OxyContin or oxycodone, and you could buy it, and it was stamped oxycodone 40 milligrams right on there, and it was made by Wyeth Pharmaceuticals. Well, when law enforcement and the medical profession finally got together and realized that, wait a minute, we have to stop this prescription drug abuse. We can't write people prescriptions for 250 40 milligram oxycodones anymore, and we shut that down. Well, what did we do? We took a large group of people who were addicted to opiates, who could no longer get it in that form, and now they had to look around and figure out how they were going to solve the problem, and they found it: heroin. Heroin is you know, it really is a great drug when you think about it. Heroin was, when it was invented, was made as supposedly a non-addictive formula of morphine. So people who were addicted to morphine, when they created heroin in the late 1800s, but around there I believe it was invented. So hey, people who are addicted to morphine, here's a great drug, heroin. It gives you all the benefits of morphine, but you won't get addicted to it. Well, we obviously figured out that that's not true. So we have a large group of people out there now who have turned to an illegal drug because they have no other choice. The other problem is we have another whole subculture of people who have experimented with drugs and become addicted. Now, from a law enforcement perspective as a police chief, this is where I differ from a lot of other people. I know that there is practically nothing that we as law enforcement officers can do to fix this problem. We can't arrest our way out of it, as has been commonly said. We can't seize our way out of it, because when you have a demand for something, people are going to make the supply available for that demand. So we could interdict tons and tons at the border, and they would find another way to get tons and tons back in, as long as there were people to buy it. So now the solution has to be treatment, education, but especially treatment for people who are addicted to opiates, because opiate addiction is different than other types of drug use. People can become addicted to cocaine, but opiate addiction actually changes the physical structure of the brain. Okay, it actually physically changes the makeup of the brain. It takes years for people who are addicted to opiate to be cured, if they can even be cured. They may be an addict their entire life. Most people would say that you are an addict your entire life. I'm a nicotine addict. Now, that's legal, it's not immoral, it's not unethical. But every stinking day, I have to tell myself, you're not going to smoke today. Well, just imagine if you're a heroin addict and you have to do that. I mean, it's terrible to be an addict, to have something wrong with you like that you get this craving for something every stinking day. But that's what people go through. And it doesn't go away in 2 or 3 weeks. It doesn't go away in 90 days. It doesn't go away in a year. It can take years of treatment, and that's important, because if we're going to do this, we have to be willing to spend the money in treatment for those number of years necessary. And if that means 5 years or 6 years or 7 years, then we have to do it. Because someone who is in a evidence-based medication treatment program that is not using heroin or using diverted opiates is a better person. They can work, they can live a normal life, they can carry on. So it's important that we look at this from that perspective. Now, I would like, and the city of Sanford, through the mayor, as he stated earlier, and I went up to Augusta with Steve Buck and some people from the Mayor's Coalition a couple of weeks ago, and we met with the Secretary of the Department of Health and Human Services, Mary Mayhew, and we're trying to develop some kind of a program that DHHS would give us some money to run on the local levels. And I sketched together a brief program based on the city, police department, a case manager, and a medical director, if we can find one, that we could develop our own law enforcement assisted diversion program here for people who are good candidates, to get them into a program of treatment so they'll stop offending, stop using illegal drugs, and stop committing the crimes necessary to support that illegal drug habit. But as you'll hear from one of our board members, panel members later on, you're going to find out that there's nobody out there to do that. There's no medical people out there. Our evidence-based methodology program closed down about a month ago. Boy, we could use it now. Because if they were still here, I guarantee you I'd have an agreement with the director of Spectrum, and I'd have a place to send these people to if we identify them, if we can get some money from DHHS to pay for it. So I guess to our legislators, we need to do something in the state to either increase the number of medical professionals who can get licensed to treat people with medication. We need to increase the number of people that they can treat, because right now it's capped at 100.
That's if you've done it for a year. It starts with
30.
30. So with the training tomorrow, you can see 30 in 2 months.
Well, that's interesting, because 30 is the target number I had for our program. I was thinking that we could probably enlist 30 people in the first year. So maybe we can find a doctor and talk him into getting the training.
Been working on it for 5 years.
Yes, I know. It's sad. But that's my perspective, is I want to see, because I know, that people who are addicted to heroin don't want to be addicted to heroin. And doctor, you can correct me if I'm wrong, but I would bet you $100 right now that if we were to put 100 people who are addicted to opiates on that side of the room, and I told everybody, I can cure anybody of their addiction. All you have to do is walk across the room. That 75% would walk across the room, do you think? So people don't want to be addicted. They don't want to be addicts, but they don't have a choice. And that's what we, as people in the community, have to understand, that this is a long-term problem. It's going to require the expenditure of money. We can't arrest our way out of it. We make plenty of arrests. I mean, my offices make a fair amount of heroin arrests, but we'll never be able to make enough arrests to solve this problem. We've got to get the demand lowered. We've got to get people to stop wanting to use the drug. And, and that's what I'm committed to. I'm committed to really working with the medical community, with the mental health community, with the substance abuse community, to develop a program where we can get the number of users to decrease, and to treat people like human beings and understand that they have an addiction and that we're going to do something to try to make it better for them and to try to get them to stop using. We will continue to make arrests as much as we can. That's part of the three-legged stool, treatment, education, and prevention. Well, we're on the prevention side. Locking you up and putting you in jail is a prevention thing. But we need to lock up the dealers. We need to lock up the importers. We need to lock up the wholesalers. We need to interdict large amounts. And then when we get to the people who are users, we need to look at them and say, okay, if I put you in jail for 30 days and you come out, you're still an addict, what's the first thing you're going to do? You're going to use. And does anybody know what the rate of people who have been incarcerated who come out of jail, what the death rate is? It's about 40 to 50 times higher than the average user. Because when you come out of jail and you use, your tolerance is down, you use the same amount, you overdose. A lot of people die when they come out of jail if they don't receive treatment and they use again. So we need to have all three legs there, but I'm committed, we'll work together as a community. Community needs to treat, community needs to provide education, and we'll work together and we'll try to solve the problem. And again, if there's questions later on, I'll be happy to take the questions. So, thank you.
My name is Raphaelle, and I work for the Attorney General's office as a drug prosecutor. And I prosecute all felony drug cases in York County. And 90% of my caseload is easily prosecuting heroin and fentanyl. And what I will tell you about the people I prosecute is that it's not generally a stereotypical junkie that's shooting up in a gas station bathroom. This addiction really affects every socioeconomic group, every age group. I have defendants as young as 18 and as old as 70. So this addiction really does affect all ages and all socioeconomic groups. It also is in every single community in York County. It's in Sanford, it's in Norris, it's in Biddeford, it's in Wells. There's not a community that does not have heroin in it. During my time as a drug prosecutor, I've seen a dramatic increase in overdoses, both in those that Narcan has been successful in bringing these individuals back, and both in overdoses that have resulted in people's death. And that is something that is very concerning. The other thing I've seen as a prosecutor is that there has been an increase in burglaries, thefts, robberies. As Mayor Cote pointed out, when you were interviewing these defendants, they are desperate. They're desperate to feed their addiction, and yet they're also desperate to get help. And part of the issue is that there is a lack of resources for treatment. I think you're going to hear that repeatedly throughout this forum, is that there is a lack of services for treatment. And in terms of my approach to prosecuting addicts, I agree, jail is not beneficial to them. They can't get treatment in jail, and as Chief indicated, typically they do short jail stints. When they come out, their tolerance is lowered, and that puts them at risk for an overdose. My approach is much different in terms of the drug traffickers. In my view, they are selling death, and we do need to prosecute them aggressively. And I am very lucky to work with very good agents and law enforcement officers that do a very good job in terms of interdicting these out-of-state traffickers. And lastly, what I would like to talk about also is that in York County, we're very lucky to have a program called Drug Court. And the purpose of Drug Court is to get addicts who've committed crimes through a pretty intensive 4-phase, generally year-long program of counseling. In the early phases, they have to come to court every week and meet with the drug court team, which is made up of a judge, generally speaking, probation officers, counselors, and they have to check in and say, right, this week you're doing well, this week you're doing poorly, and the aim is, if they're successful, hopefully they are no longer using, they're productive members of society, and their charges will get reduced. We have had some who have been unsuccessful, and the hammer swings the other way, but it's an extremely good program, and I'm definitely happy to answer any questions about that program or prosecuting drug cases in York County. So thank you.
So again, I'm Andy Powell. I'm the co-medical director of the emergency department here at Southern Maine Healthcare, Sanford. So I'm going to talk about addiction in general, and so many people often have a misconception of what addiction is. People think that a drug user has a choice of whether they use or not, so why don't they just stop using? They've been using for a while. They can just make a decision to stop. They're a person. They have independent thought process. Choose to stop. And a lot of us don't understand why they can't do that. While the initial drug use may be voluntary, so you might be at a party or somebody gives you something, that initial choice you typically have to make, that I will try that. Oftentimes, very quickly after that, the choice is no longer yours. There are actual chemical changes within the brain involving the neurotransmitters, which are the messengers that send signals throughout the brain, creating the brain or making the brain cells send signals to the rest of the body. There's a neurotransmitter called dopamine, which is affected by addiction. And this dopamine works in the reward circuit of the brain, which is an area of the brain that produces a positive response to things in the environment. So oftentimes that can be like eating, sexual intercourse, that type of thing. It produces increased dopamine, which gives this positive feeling in the body. Drugs like heroin actually produce 2 to 10 times the effect of dopamine on the brain. And so this creates this euphoria, or this very, very strong positive feeling within the body that makes a user want to use again and again and again, and just positively reinforces that activity. So that in and of itself makes it very difficult for a person to stop using once they've had that experience, for the same reason that we still eat, because it is typically a pleasurable experience. Over the long term, this drug use actually suppresses the dopamine in the brain, the natural dopamine, that neurotransmitter. It actually suppresses the production of that. So just in order to reach your baseline status of how you normally feel on a daily basis, you actually need the drug to reach that level, and you need even more drug to reach that same euphoric effect or that very positive effect that you had the first time you used. So that process is actually called drug tolerance, and I think a few others have referred to that. So over time, you require more and more drug to reach that same euphoric high, and it's this snowball effect where you're just you're feeding into this addiction, and it just becomes stronger and stronger and really overtakes the person. Heroin in particular is a powerful opioid medication, as we've already talked about this evening. It has 2 major effects. It causes that euphoria, but it also makes people feel relaxed. So it has 2 very positive effects for the user. we kind of referred to this, but people typically get addicted to heroin because they've started on a pain medication for a particular reason. Maybe they broke their leg and were prescribed, legitimately prescribed Percocet or Vicodin, hydrocodone for pain control of that issue. And the number of times that I've heard that in the emergency department, I'll ask a person coming in that is there for or looking for treatment options for heroin abuse, how did you get started? What was that initial thing? How did you get to this place? And by far the most common response is that they had an injury. They were prescribed the medication, and then the injury got better, and the prescription stopped, and they no longer had access to that medication anymore. And so, as Tom Connolly was talking about earlier, at one point they would actually replace that with illegal versions of oxycodone. They might doctor shop, they might go to the ER, to get a prescription prescribed to them, or they might buy it off the street, that sort of thing. And then as we've tightened down on the control of that, heroin has replaced the prescribed medications entirely. And so now heroin is the drug the streets for because it's cheaper and it's easier to get. So there's other things that are connected with other problems that are connected with heroin use because it is mostly used by IV or intravenous route, which means people are injecting it into their vein. So in connection with that, there's often sharing of needles, which increases spread of infectious disease such as hepatitis C, hepatitis B, HIV, which are obviously very serious conditions that can lead to long-term medical problems or death. So there's that connected with heroin use, but there's also that strong drive to get the drug. Oftentimes, a user's next fix will top any other thing that they're dealing with in their life, and so they'll do anything and everything to get that next high, including crime, hurting their family members, stealing from family, that sort of thing. And so they really become very desperate and don't really think about the consequences. So ultimately, it's not only the user that's suffering; it's the loved ones, it's the community, it's really everyone around that suffers from their addiction. So you might ask, why does one person use a drug once and they're never use it again and they're fine, whereas another person uses it once and they're addicted and they can't stop? There are some predisposing factors to addiction. Addiction is a disease. And there's kind of a multitude or multifactorial reasons for why somebody might get addicted or have a stronger addiction than someone else. So the risk factors include aggressive behavior in childhood, lack of parental supervision, poor social skills, drug experimentation, availability of drugs at school, and community poverty. So on the same note, there are also protective factors in a community that can actually prevent addiction or buffer addiction and make it less likely that somebody would have severe disease. And those include a person that has good self-control or is taught good self-control in the home. Parental monitoring and support is huge. Positive relationships at home, at school, friends, teachers, all of those impact a person's life and are involved in how they make decisions. Academic competence, so doing well in school, actually is tied to people's likelihood of becoming addicted. School anti-drug policies, so keeping drugs out of the school is hugely important, and I'll go over a little bit more about why in just a minute. And then neighborhood pride, so just having a strong community pride is a big part of this. Standing up for your community, fighting against this issue. Everyone here today is interested in this. Coming up with a solution. Those are all big parts in kind of balancing out the risk factors for addiction. But I think the most important thing to realize is that no one is immune. So as we've already said, it doesn't matter whether you're rich or poor or white or black or male or female. It doesn't matter. Anybody, everyone is at risk for addiction. Heroin addiction, alcohol addiction, whatever the addiction may be, anyone is at risk, and everyone is at risk. One other important point that I want to make is that age is a big factor here. The youth are particularly vulnerable to drug use, and this is in part because their brains are still developing, and in particular, the decision-making portion of their brain, the memory portion, the learning portion, the judgment and self-control portions of the brain are still under development. And so if you start throwing drugs into the brain at that point of development, it changes their whole brain structure, and then the addiction problems become even worse, but also they're not able to learn as well, so they tend to have lower jobs. I mean, it affects their entire life from that point forward. It also, youth are more likely to take risks or risk-taking behavior, and so it's a tender time of their life, and should be protected, because that is, these drugs and having drugs around them has a huge impact on their entire life from that point forward. And I think that's pretty much all that I have to say right now about addiction. So if anybody has any questions afterwards, I'm more than happy to entertain those. So.
Next up is Kate Meredith from Maine Behavioral Health Care, who was an excellent resource, and thank you for speaking.
Thank you, and thank you all for coming. Addiction is a disease like diabetes or hypertension. It can kill its victims slowly and painfully, and affects everyone around the sick person, family, friends, and colleagues. It also has a significant impact on our communities and our country. The impact addictions have on this country is very costly. As many as 25 million Americans are thought to have addiction. According to the National Institute on Drug Abuse, the disease costs $700 billion annually in treatment costs, crime, and lost productivity. The most significant cost is what it does in lives. Deaths from heroin overdoses jumped fivefold between 2001 and 2013. Yet only 1/10 of those 25 million people get any help. A comprehensive approach to this problem is required, where the legal system, medical and mental health providers, community organizations, and families work together to support the recovery of those individuals affected by disease. Timely access to care is the first step to recovery. Services need to be accessed at the right time, as quickly as the person has made up their mind. It's a small window of opportunity. We at Maine Behavioral Health Care have made this possible with our open access services. This allows people to be seen at the same day they walk into our Springvale or Biddeford offices. We have open access handouts available at the back. Maine Behavioral Health services include, in Springvale and Biddeford, intensive outpatient and outpatient services. We also have crisis response services available to help people go to a crisis stabilization unit for a short-term stay if needed. One of the major barriers is lack of insurance and changes to Maine Care eligibility. We are here to help people who are uninsured. At MBH, we have a grant from the Office of Substance Abuse, a state agency for people who are uninsured or underinsured. This grant allows us to offer services on a sliding scale fee with eligibility based on federal poverty guidelines. We offer care for as little as $7.50 per hour for some services. Last year in York County, we served 732 York County residents seeking substance abuse treatment. 394 of those residents were treated on our Office of Substance Abuse grant. The most successful recovery programs are those involving community treatment for addiction, ongoing treatment with the right combination of intensive outpatient, medication, and recovery. Support is the only logical answer to this epidemic. Maine Behavioral Health is in the process of developing a strategy to address this community need in a way that is sustainable, and we know that the best approach will be to develop collaborations with other health services, strengthen relationships within the community. Together, we can be strong. Thank you.
Thank you, Kate. Now we'll have Dr. Norris speak, and I'll let her give a little bit more about her background because I don't want to leave anything out. But thank you, Dr. Norris.
Well, the first thing I'll say is that I'm much shorter than a lot of the other speakers, so you're going to have to bear with me on that. I've been practicing in Maine for about 12 years. I'm board certified in osteopathic family medicine, addiction medicine, and obesity medicine. I've been treating addiction in Maine for about 9 years now. I'm the medical director of Grace Street Recovery, which is a program that has an intensive outpatient program and uses Suboxone. We're in Portland, Lewiston, and Bath. I'm medical director of Cap Quality, the methadone clinic, and have been of Spectrum, which was down the road until you know what. And have also worked at Mercy Recovery, filling in slots, and at Milestone Detox. At one evening, I was working for both of them and actually transferred a patient to myself. So if you have a heroin problem and you live in Maine, the chances that I have either met you or someone who you're friends with are pretty good. I wanted to talk a little bit about some of the common myths involved with treatment, because despite the fact that I have all this experience, you'd be amazed at how many experts there are. One of the first that I always hear, particularly within the old school recovery community, is that medication, whether you're doing Suboxone or methadone, is just switching one drug for another drug. And everybody says this, like they're the first person ever to lay that down, and like they're just the genius and they're going to lay it out for me. Cocaine for heroin is switching one drug for another drug. Heroin for oxy is one drug for another drug. If you have a drug problem, you are somebody who is not functioning. You are someone who is continuing to use despite the consequences of your use. That includes someone who keeps drinking after they get a bunch of DUIs, and that includes someone who keeps using after they've lost, their job, their children, their significant other. If you're on treatment that uses medication, you have not swapped one addiction for another. You have gotten treatment for your problem. We don't say, well, you're on insulin. That's just using a replacement for your pancreas. Well, kind of, but it's also a way of keeping your system functioning, because as Chief described, you don't really have a normal functioning anymore. You can get sober from alcohol through abstinence and through programs. Opiates are a different animal. Your brain doesn't work right anymore. If I put you on a desert island when you had a heroin problem and kept you away from heroin, you'd get through detox and you'd be miserable, but you still wouldn't be okay. And it doesn't matter what I wish were true. The data is that the relapse rate for people who are not on some kind of medication for opiate addiction is upwards of 94%. Doesn't matter what my opinion is, that's the data. If I had an illness that could kill me, I'd want the treatment that had a better track record than 6%. I think everyone in here would. So that's a really important stumbling block, especially when you've even got the district attorney and Brewer on TV saying this is just legalized heroin. It's not. One of the myths is that if you do pain pills at all, you'll become addicted. How many orthopedic patients do you see, Dr. Powell? Yeah, and are they all like roaming the streets, knocking out, Radio Shack? Right. Most people who are exposed to opioids do not develop an addiction. Of the people who develop addiction, a substantial portion were exposed through some legitimate way, but they are not getting it. It's not like you get a knee surgery and now you're on the road to ruin, but that is another common myth. If we're talking about methadone in particular, no, it doesn't wreck your bones. No, it doesn't wreck your teeth. No one's sure where that myth comes from. A lot of people have bone density problems, but that's because of years of poor health. The methadone doesn't do that. Your baby is not born addicted if you're on treatment. Your baby might have changes and need to be monitored. If you're on insulin while you're pregnant, the baby's going to need some transitional time too. Babies have basically the same outcomes on the long term if their mom is on replacement therapy as if mom wasn't on anything when she delivers. The other thing is that supposedly all of us at methadone treatment or in any kind of drug treatment, what we want is to keep you here forever. We want to keep you here for the rest of your life and put you on the maximum. And I've seen those zombies walking around. And they're just, I just heard a lot of bad things about methadone. I see way more methadone patients. And I work at two places. I see way more people on methadone than Joe Sixpack does. If you can tell somebody's on methadone, there's probably something else wrong with them beside that they're on methadone. There are people who are what we call lifers. their brain never gets all the way back. Just like there are people who have had a stroke, another kind of brain injury. Some get a little rehab and they're fine. Some always have a little bit of a slur to their speech. Some always walk with a walker. And you don't always know who's going to be who at the outset. But I'm there whether the patients are there or not. I'm not really interested in keeping people there and putting them on the maximum dose. What I want is them to be normal so they can stay out of jail, so they can take care of their kids, so they can work their jobs. There's business owners that I see as patients. There are great parents. There are great people. They're a lot of fun, most of the people I work with. And overwhelmingly, they are not criminals. They are people that you would want to spend time with. There are a few criminals, but I would say that's also true about my population of people who have seizure disorders or who have diabetes. One of the greatest myths that I encounter is that, well, when people are finally ready, you can send them to rehab. I actually had a physician assistant tell me that. Anyone know where there's this rehab of which they speak? Like Dr. Roux is not interested in taking the Maine care patients in Maine and taking them into, that's not a thing anymore. That used to be an available resource. In Maine, I have often been on call for Mercy, when Mercy was still Mercy, and gotten calls from people in Caribou saying, we have a guy who needs help. Unfortunately, I have been in the position of having to ration resources. As we talked about, I can treat 100 people with Suboxone. I can treat more people with methadone, but even those 100 people, I have to always be doing the juggling act of, if this person isn't doing well, do I get to keep them on the island or do they get voted off because there's someone else out there who's going to have an overdose because I didn't have room? And for the past 9 years, I've been begging friends and colleagues of mine, please get certified to do this. Like, just call me at 3 in the morning if you have questions. Look, I'm moving from one community to another. Do this, help out. There's people who are going to die. I'm not really interested in working with those people. Yeah, and these are physicians. Imagine if we said that about Coumadin. Coumadin's kind of a pain to manage too, but we do it because it's good medicine, right? If everyone in Maine was getting a blood clot, it would be unconscionable, but that's not how we're doing it. If I'm seeming a little irritable about this, it's because I've been feeling a little like Chicken Little for the past few years. We tried to do a Grace Street Services right over there at the Midtown Mall. Do you know why we couldn't? Anyone? You probably don't even know this. There's a statute in the city of Sanford that you can't have drug treatment in downtown Sanford. There can be no treatment programs or programs for mental illness in downtown Sanford or near a school. Think about the message that you're saying, because everyone in recovery is a throat-slashing criminal, right? And we need to keep them far away from. Ironically, a patient of mine overdosed in that same parking lot where we were going to have treatment program. Even more ironically, there's OTB there now. You want to think about the message you send that it's okay to have gambling downtown, but it's not okay to have treatment downtown. And meanwhile, the methadone clinic is off in the woods, and it was very difficult for people to get there. There's a lot of other myths, but the biggest one is that it's those other people that we want to keep away from us. I've treated people all over the state. They don't all do great. Also true of my people with blood pressure problems. The police have been nothing but supportive. Bob McKenzie's been great. All of the Sanford people have been great. Chief's been great. This is not a problem of failure to collaborate with law enforcement. We just need more resources, and the community needs to be ready to let us in and do some help. Thanks a lot.
Next up is Connie Roux from Partners for Healthier Communities.
She's not the shortest one in the room. Well, I don't know about you, but when I come to a program like this, I always want to leave with something to take with me. Everyone comes here looking for an answer or something that they could do or some thought they could leave with. This problem, as we've talked about, is complicated and it's overwhelming, and we don't have all the answers. We have a lot of answers, but we have no one answer. But there is something that we can all do, and you can leave with that today, and that's prevention. Everything that Dr. Powell talked about, all those risk factors and protective factors, each and every one of us can take responsibility in our communities for doing something to either work on what can we provide our kids in our community so that they have positive choices, they have good outcomes, they have positive things to do that do not involve drugs and alcohol. What are those things in our communities that make it easier for our kids to use drugs and alcohol? How can we eliminate some of those? Those are the easy steps. Those are the hard steps, but those are the things that all of us can do something about. So my challenge to you today is to go back into your communities and see what you can do to build some of those protective factors and reduce some of those risk factors. Now, you don't have to do this alone, because fortunately, all of our communities in York County have funding. Here in Sanford, we're very fortunate. The office that I work out of, we get funding from the Fund for Healthy Maine to address substance abuse prevention. We also, Nicole Ivy, she's here somewhere, wrote a wonderful grant and got for our community a Drug-Free Communities grant. And both of us are prevention specialists, and we spearhead a lot of activities in our community that address these issues. So hook up with one of us, connect with one of us. We have resources. We will talk to groups. We work with many partners in our community. Everyone on the panel is a partner of ours. We work with law enforcement. We work with the schools. We work with businesses. We work with the faith-based community. So it takes a community to have a drug-free community, and that's what we want for all of our youth, is to live in an environment that supports good choices and that gives them opportunities to thrive. So I challenge you all to go back into your communities, if it's Sanford or Biddeford or wherever you live, and to see what you can do to get involved in helping to keep our youth off of drugs and alcohol. I talk to a lot of treatment people, and the common theme from them is, yes, a lot of people that are addicted to opioids and heroin, they didn't wake up one morning and say, I'm going to become an addict. They all started somewhere, and they all started with either alcohol, marijuana, or some of those gateway drugs, tobacco. So if we can keep our kids off of these drugs, these gateway drugs, we're hoping that we don't have another generation of what we're trying to help today. So we all have work to do, and there's lots of resources in your communities. Please take advantage of them and help us out and join us in our task. Thank you.
All right, so next up we have Miranda Gilman, who's going to be talking about her journey through recovery. So please, everyone, give a warm welcome, and thank you, Miranda, for being here.
Hi, everyone. My name is Miranda Gilman, and I just wanted to first off say how grateful I am to be here speaking to all of you today. Not only that, I am grateful to be alive, because about 5 years ago, I really didn't know if I was going to be here today. Not just here speaking to you in recovery, but even just here still using. I didn't picture this for myself. But I connected with Nicole Ivy recently because I put a post out on social media from a Sanford community page because a friend of mine had passed away. And I was feeling upset and scared and lonely and all those feelings that you don't want to feel in recovery. And so instead of taking it and doing something negative with it, I decided to use it for positive. And I made that post on social media, reaching out to my community, people that were still using, people that have family that are in active addiction. I just wanted them to message me. I wanted them to know that they are not alone. And if they are trying to find help, that I'll look too. I'll help them and I'll be there for them. And when they get the help and they're in recovery, I'll support them still. I had a few people message me, and I was able to give some information to a few people. One of the women that I talked to actually just went to treatment in Florida last week. And I thought that that was really powerful, and that meant a lot to me that she reached back out to me to tell me that she was going to treatment. I got a message from Nicole, and she asked me if I'd like to be a part of this. And I'm not gonna lie, it's my first time doing something like this and talking about my past outside of an NA community. But I'm excited to be here and to be a part of something greater, to use my negative experiences in a positive light to maybe help someone Because if I can help one person, just one person, stop using and get help and learn a new way of life, if one person can do that, then that makes this all worthwhile. All this anxiety I have right now is totally worth it. Like anybody's story about their life, mine starts with my childhood. My earliest memories, I can remember feeling out of place, alone, confused. But my sister was born, and that kind of changed things. She kind of gave me a sense of purpose, and then I had another sister come along later on, and then I felt even better. But I never knew my biological father, so their father treated me different than he treated them. And once he had his own children, a relationship with me was unnecessary. I suffered many different types of abuse at his hands, and throughout the years, as I got older, it only got worse. It was hard for me to understand why what was happening, what I had done, what was going on. So I looked for anything and any way to get outside of my mind, outside of myself. It was a constant search, and it started when I was really, really young with food. And I overate and would hide it because I was ashamed. And you know, those behaviors were instilled in me pretty young because I didn't know how to deal with it, and I didn't know who to talk to or where to go because I was just a kid. I lived in a household where both my parents smoked cigarettes, so when I was 10 years old, I started stealing cigarettes from them. And when I was 11, I started stealing my stepfather's marijuana. And then when I was 12, I started stealing his alcohol. And eventually it just got worse and worse. I acted out at school and acted out at home because of the abuse that was going on, and I didn't really reach out to anybody. And looking back, I know that I really should have. I shouldn't have waited as long as I had, but because of the acting out and nobody knew what was going on at home, I got a lot of psychiatric referrals and went to a lot of different doctors, got put on different medications. So I ended up with this psychiatrist who would change my medication, I don't know, twice a month, and that's really dangerous. I don't know who knows much about that, but it's really dangerous. And it kind of taught me that, like, oh, well, I can just take a pill for this. I can just take a pill for that. I can take a pill for that. And it's not a big deal. And I was on a lot of the wrong medications, and that started self-mutilation and suicidal ideation, and that became another addiction that I had. And that was something that was really, really hard for me to conquer, but it was just as powerful as the drug addiction. You know, they both came hand in hand. I was over-medicated, and I never took my meds right, and then I had an incident one night with my stepfather, and it was really terrible. I had saved up my psychiatric medication, and I had tried to kill myself. I had attempted to kill myself. And, you know, looking back now, I can tell that there was a reason why the plan didn't go through. I ended up in a mental hospital, Hampstead, New Hampshire, and I met a doctor, Dr. Knight, who correctly diagnosed me. And it was the first time that I had ever heard of something called dual diagnosis with the mental health and the addiction aspect of it. You know, and he got me on the right medication, and he got me on the right path, and I built relationships there that would open a door for me because I just left the mental hospital when my insurance had run up, and then went right back to the same environment. And I didn't fare very well for long. I was back at the mental hospital a month later, and I had established some really amazing connections there beforehand. I met some really great people. So that opened the door for me in a poetry and art group that one of the counselors ran to connect with that counselor. And I finally felt that I was able to trust an adult. And the second time that I went back there, I told him what was happening at home, and I said what was going on and how I felt, and You know, it was definitely a big burden lifted off my shoulders, but I also was removed from my home, and I moved in with my grandparents, and my life completely changed. They were the loving, caring, supportive family that I feel is important for everyone. My grandparents are a big part of my support system, and my grandfather was my savior, I felt back then, because he was the one who said I would be going to his house. And that meant a lot to me. But with that, they also didn't know much about what was going on with me personally. They knew about the stuff that I had to leave for, but they didn't really know personally what was going on with me because they don't understand the mental illness part of it or the addiction part of it. So I had a lot more freedom all of a sudden because they trusted me and they loved me and they wanted me to be happy. So with that freedom, I am lucky that I graduated high school. I was able to go out with whoever I wanted, pretty much do whatever I wanted as long as I was in by a certain time and as long as I was going to school and keeping my grades up. So I kind of was able to skate by. I was drinking one night when I was 16, and I used to skateboard, and I hurt my back. I fell off my skateboarding, drunk, and hurt my back. So that was the beginning of the end. I ended up with a prescription. You know, we've talked about it with the other panel members. I ended up with a prescription, and that's how my addiction didn't start, but took off. The opiates, once I was on the opiates, there was no looking back. I didn't just feel no pain in my back. I felt no emotional pain. I felt no mental, physical. It was all gone. I felt like it was this magic cure-all. But what I didn't realize was that magic cure-all was just like a Band-Aid. And once the Band-Aid ripped off, I was going to start bleeding again. I had a string of bad relationships throughout that time, and I found out at age 19, because I had state insurance, that I would be losing my insurance. And that was what was paying for my medication. So I lost my insurance, and I lost my medication. So I had to find it elsewhere. I happened to be dating someone who sold drugs at the time, and it just got worse and worse from there. I found out my grandfather had cancer, and I came home. I was still heavily using to deal with the emotional pain, but I took care of him. And my grandfather was one of the major positive people in my life, so it was important to me to take care of him and be there. But with all of that, and with all of the pain from my past that I hadn't dealt with, when he passed away in 2009, it completely rocked me. My entire life, my entire foundation, I felt crumbled beneath my feet. That's when I was introduced to heroin. My boyfriend at the time thought that he was spending too much money on my pill addiction. So he wanted to save some money and introduce me to it. And I won't lie, I am someone who went straight to intravenous use. And it was great at the time. I thought that I didn't really know much about drug addiction. I just thought that I was somebody that liked to get high. I thought that I was somebody that could use drugs, and then eventually someday when I wanted to do something else with my life, when I wanted to start a career or this or that, I would just be able to stop. But that isn't the case. And dating a drug dealer, you do things that can get you in trouble, like selling drugs for them. And I did, and I got in trouble. The New Hampshire DEA and Exeter Police Department arrested me on March 5th, 2010. And honestly, I look back and I'm thankful that that happened. I'm grateful that that happened. because while I was waiting to be sentenced, I was in Stratford County Department of Corrections, and they had this amazing program there called the Therapeutic Community. I did not know what addiction was until I walked into that room. And those women and those counselors, they taught me all these things that I kind of knew inside about myself, but didn't have a word for. I was an addict. That's what was happening. That's why I was so confused. That's why I was so angry. And that's why I didn't know how to deal with the pain, was because I was masking it and I was covering it up with the drugs. And once I took the drugs away, I was able to sort of process some of that pain and that hurt from the past. And once I did that, you know, I learned these great things about recovery that you can't unlearn. You can't unlearn those things. You get taught those things, and no matter where you are in the future or what you're doing, you can't unlearn it. From there, I graduated the program. I learned so much, and then I was sentenced to go to the New Hampshire State Prison for Women because drug dealing is a major problem in society. Even in 2010, it was a big problem. And so I ended up with a prison sentence, and I went to the prison, and I did what I needed to do. I didn't get in any trouble. I kept my nose clean. I just did what I needed to do so that I could be eligible for their halfway house program. And 18 months to my minimum, I was able to go to their halfway house program. I only spent about 6 months at the prison, and then I went to the halfway house, and that's when I was introduced to the NA community and the recovery community and the public. These were things that I never knew were there. I never knew were a possibility for someone that was looking for help, that was looking for support, that was looking for other people to connect with that think and feel the same things. And once I figured that out, I was able to prepare myself better. That right there, going to prison, that right there was the start of the rest of my life, because I never, ever wanted to end up back in that place. I never wanted my addiction to take me down that road again. And when I got out of the halfway house, I went back to Exeter, which was probably not a good idea for me. I went back to the same people, places, and things that I had known forever. And when I went back, I relapsed. And the thing that I did next was the most important thing that you can do. I asked for help. My parole officer, his name was Jeff Shanahan, and he was an amazing man. I relapsed a decent amount of times when I was on parole, but I asked him for help, and every single time I asked him for help, he helped me. The first time I asked him for help, he sent me to a LADAC counselor. And through the parole board, through the parole, I was able to see the LADAC counselor. And she told me about a grant for recovery that the New Hampshire Parole Department had just gotten. And they helped me go to a few different rehabs. I went to an outpatient program, an IOP program in Greenland, New Hampshire. And that was helpful. The guy who ran it was an amazing man, and he was in recovery. And it was amazing to hear from a person in recovery as a counselor, their point of view. That meant so much to me. And then I went to another place called the Phoenix House, where I met a woman who taught me about spirituality, because that was my biggest problem in recovery up until that point, was the whole religion and God aspect, because I'm not someone who is extremely religious. But it doesn't matter who you call him, what you call him. Ultimately, there is a higher power out there in general. And she taught me about the spirituality aspect of it. And because of that, I think I was able to start healing even more. I went home from there, and I ended up relapsing a few months later. I didn't have the supports that I needed, which was the problem. I ended up going to a place in Manchester, New Hampshire called Serenity Place, Lynn's Place, and I was one of the trial people. I was one of the first 10 women to be a part of that transitional living element in their program. They had had a detox and a rehab there, but they had never done a transitional living aspect, and that was amazing. I built such a great foundation there, and I'll never forget the people that I met there, the recovery that I gained there, the knowledge and the self-esteem even that I built there. I made a big mistake again, though. I came home. I went back to Exeter and ultimately relapsed again. I burned so many bridges prior to that, though, that my mother was done enabling me. She had enabled me for so long to continue to just come home after I made these bad decisions that she couldn't do it anymore because she couldn't sit there and she couldn't continually watch her daughter killing herself. And I hold no resentment against her for that, because that is ultimately what led me to be here today. I was homeless, and homelessness took its toll. I was alone, desperate. At times I felt suicidal, and I called a childhood friend back from middle school that hadn't been a part of my addiction process. She hadn't seen all of that. She hadn't been a part of it, but I was honest with her and I told her about it, and she took me in. She let me come to her home here in Sanford, Maine, and that was one of the greatest things I could have done. I was still using here and there when I came out here. I wasn't using every single day, but then using here and there turns into every day, and I was given one last chance from her. She told me that I needed to get my life together, or my only place to live wasn't going to be there anymore. So I got serious. I made some calls. I found this program in Biddeford, Key 3 West, and it was a medication maintenance program. And I had tried so many things. I had tried halfway houses, transitional living, I tried rehabs, detoxes, outpatient, and none of it worked. I went to this program and I met with these people and I took this medication, and I did it the right way. I took it the way it was prescribed. I went and met with the counselors. I went to the IOP program, which was 5 days a week, 4 hours a day. You know, I did the work this time, and I fought extremely hard. While I was there, I found out that I was pregnant and that I was going to have a baby. That made me even more serious, because I knew that there was no way I was going to be able to take care of my son unless I knew how to take care of Miranda first. I'm very thankful to be here today. I am very thankful that I was able to find that program. I am very thankful for this meeting here, because it just goes to show that if we can get together as a community and we can brainstorm different ideas, then maybe we can figure something out for our community. Maybe we can start saving people one by one, because the people that are dying, they just need support. And asking for help is one of the biggest things for an addict, I feel. If you can't reach out and you can't ask for help, then you're alone. And if you're alone, you're really not going to get better. It's really, I can say that every addict I have talked to personally in recovery has told me that there is absolutely no way that they could have done it on their own. I've been clean now for 2 years. I've been in recovery now for 2 years. I have a beautiful family. I have an amazing little boy. I'm standing here in front of my community, sharing my story with them. I never ever thought that I would be here today. I never thought that I would be here today. But I am so thankful to be given the opportunity to stand here in front of you and to tell you my story, because I can genuinely say that if I can make it through it, then anyone can.
That was amazing. Thank you, Miranda. And I have to say, she's an excellent mother, because the kid was here for a long time and never made a peep, so well done. There's a few other people who were mentioned who I'd like to stand up or step forward. I see you hiding, Nicole. That are resources within the community. You've heard the names, and it's important to understand who they are and put faces with them. So, Nicole, I know you're trying to hide behind the WSSR booth, but please, raise your hand. Sheriff King in the back there has been a huge asset, and I can't tell you how much his philosophy mirrors the chief's, and that his officers are trying to find help for the people they're releasing. I mean, it's a pervasive attitude, and it's a wonderful one to have. And Bill, will you also stand up as a community resource in the Biddeford area? I'm not sure if Sally is here. Maybe not. But again, he is a substance abuse prevention person just like Connie with the Healthy Maine Partnership out in Biddeford. So thank you, folks, and thank you for the panel for everything you do. Well, thank you, everyone, for coming. And, there is a lot of resources up here. Feel free to reach out to them. Sanford has a lot of promise. You have the Mirandas and the Connies and the Dr. Powells and the Chief Connollys out there working. Use them, support them, because they can help usher in an era of change. Thank you.